Okay, so me and my friend, Mr. Corgi, were out on a walk one day and noticed this old man just sitting up and looks like he had trouble breathing. So we arrive at the scene and first use BSI and then check for scene safety, which is good. So since the patient is sitting up, I consider if C-spine needs to be held, but for right now, without any of these other symptoms, it looks like it does not need to be. I tell somebody who's also staying nearby to go and call 911 for backup, and then I go through my general impression. So the patient is sitting up, they're breathing heavily, and it looks like they have hives or urticaria. So I walk up and I'm going to go through AVPU, and when I approach, they don't look up. But when I walk up and say, "Hello, my name is Paige, I'll be your EMR today. What is your name?" They turn their head and notice me and say, "Hello, my name is Mr. Barry." So they are alert to the speaking. So I then have my second, Mr. Corky, begin to take vitals on him. And then from there, I will go through XCABs. So I will go and pat down all the areas of his body to check for bleeding, and there is no bleeding found. I will check the carotid and radial pulses at the same time to check for rate, rhythm, force, and synchronization. And then from there, I will look, listen, and feel for his breathing, which seems very rapid. Um, I will also check his airway, which is patent. Nothing is obstructing it. Um, but once again, the breathing is rapid and slow and very shallow. So I'm going to give him a non-rebreather at a flow rate of 15 liters per minute and O2 saturation of 100%. Um, from there, I'm going to ask Mr. Corgi to give me all of his vitals, and he states that Mr. Bear has a blood pressure of 80 over 60, which is very low, urticaria, a state for the skin condition, breathing rate of 25, which is high, and heart rate of 120, which is also high. So from there, I'm going to go through sample, first seeing the signs, which are urticaria, low blood pressure, difficulty breathing. I'm going to ask him for his symptoms. He says it very slowly, and it's kind of hard for him to talk or think. And he says that it's hard to breathe and that he feels really nauseous and dizzy. I will then ask if he's allergic to anything, and there he responds bees and pollen. I ask if he's currently on any medication. He says that he just carries his EpiPen around in case of an allergic reaction. I ask for his past medical history, if this has happened before, and he says that he has been stung by a bee and it felt like this, but it also felt like this the first time he fell in love. I asked for his last input and output, and he says that the last time he ate was for lunch and he had a salad, and the last time he went to the bathroom was right after lunch, and that was about 2 hours ago. Um, so then I'm going to ask him what the events leading up to this were, and he says that he was just strolling around, sitting in the park, and then suddenly he felt a sharp pain in his upper arm, and then it became harder to breathe, and his skin became very itchy, and the hives started to appear. So from there, I know for sure that he is having an allergic reaction and is likely going to anaphylactic shock since his breathing is still very, very ragged. Um, so luckily he has his own EpiPen with him, so I can easily help him administer the epinephrine. So he grabs it out of his shorts, and then with my hand guiding his, jabs into his thigh, holds it there, and this is after I've already checked to make sure there's nothing in his pockets. And then once it's released, I put it aside so that it can be disposed as a sharp and rub the area where it's administered in order to make sure that the medication fully goes through. Luckily, from there, transport has arrived, so I tell them exactly the time that the epinephrine was administered, and I go through all of his vitals, saying that he had a low blood pressure, a fast heart rate, a high respiratory rate, and the urticaria, and tell him that he is allergic to bees and that since he was outside and felt this sting in his arm, he was most likely stung by a bee, which caused this reaction. And that I administered epinephrine to help him and put him on the non-rebreather mask in order to help his breathing.